Hi guys, how's it going? This is Dr. T, a Burst Ambassador, practicing out of San Diego, and I just want to talk about a few things that I'm doing to prepare to start seeing patients after this whole quarantine, shelter in place is over, or when we're allowed and we get the green light to start seeing patients. There's a lot of things going around, some suggestions that are being made. So I'll do my best here to share with you what I'm doing to protect me, my team, and most importantly my patients when they come into the office. So I put together a little protocol, COVID-19 protocol, plan and protocol, and I'm just going to go over this list here. A few things, a few office upgrades. I've implemented HEPA filter purifiers to the 2 operatories that I'm going to be working out of. My office is plumbed for 3, or have 3 operatories, but I'm only going to start using 2. And I'm currently using the Medify Air model MA40. You can see right here, if we can focus. Alright, so 1 in each operator that I'm using. I have a 3rd one that I originally invested in when I first acquired the practice, and that is for the main office. So 3 purifiers filtering air out of 700 square feet I think is plenty. The one thing you guys have to remember or think about is, does the purifier have the capacity to filter the air due to the size of your office. Also, I'm gonna start changing the doors, or not doors, but I'm gonna have them propped open. Before, there was a door between the lobby and the operatories. Now I'm gonna keep that open so patients do not have to touch the door to walk in. Also the front door too, I'm gonna keep that slightly cracked open so you can fit one person walking through, and they don't have to touch the door when opening and closing. So that prevents less touching for them and keeps them clean. Alright, in terms of scheduling, when I'm scheduling my patients, I've added an extra 15 to 20 minutes to appointments. So that gives me time to wipe down chairs, turn over, and also when we spray the room down, it lets the air kind of breathe so it doesn't feel or smell toxic, or the fumes can kind of recycle out. We will have a maximum of 1 to 2 patients. My office is pretty small, alright, but I've kept it to 1 to 2 patients, so 1 patient in, the next patient, is outside waiting in their car or wherever they may be, just not in the office, alright? And that just limits cross-contamination with the aerosols and, gives time for the patient to feel safe and clean, that there's only 1 patient in the office. It also is more of a comfort for the patient knowing that they're the only ones in the office and no one else, so it's mainly focusing on them, the patient. Before the patient comes into the office, we send them a text. We verify their appointment via text and make sure that they are screened for COVID-19. Alright, after that, then we say, okay, you are confirmed, and show up to your appointment. The morning of, we make sure to remind them, hey, wear your face mask, and if you feel any symptoms in the morning, if anything has changed, let us know. They text us when they get to the office, we verify and make sure that everything's good. Then they can come into the office. We make sure there's only 1 patient at a time in the office, 1 to 2. And then from there, the patient walks in, the door is already slightly open, so they don't have to touch the door. They go to the front. Alright, and in the front, what we're doing is thermometers. Alright, so for example, here, 98.1. Check the patient. Alright, we ask them the questions again. They sign their consent forms for the treatment for that day and for the COVID-19 consent form questionnaire. Now, we're trying to minimize paper and do things digital, but at this point, we're not quite there yet. So what we're doing is we're just having pens, and then when they take the pen, they keep it. So it's also a good marketing campaign. So for those who have practices and still using pen, consider that, or wiping down the pens after every use. After that, also my front office has hand sanitizer, alright, and then they give them the hand sanitizer, and then they walk back. Before sitting down, okay, to their respective chair, I have my patients, rinse with 1% hydrogen peroxide. You can buy 3% hydrogen peroxide at the store, okay? And what you gotta do is whatever, you have to dilute it. So put, a small amount in a cup, and then whatever that amount is, add water, but 3 times that volume. Mix it around, have them swish for about a minute. That helps with, fighting against COVID. Then they go down, sit down in the chair, okay, and then we go about doing our business with the treatment. Once the patient is done, they get back up, we give them another mouth rinse. It can be hydrogen peroxide, or sometimes, we give them Listerine or chlorhexidine, depending on what they feel that day or what was done with the appointment. After that, wash their hands again. They go to the front, and then they can handle any, payments, scheduling, all of that, either in the front or in the chair, okay? Then before they leave, we make sure that they have another dose of hand sanitizer. So that's pretty much the patient flow, okay? It's pretty seamless in and out, all right? Minimal contact, minimal waiting in the office. So it's a pretty safe, filtered environment for them, focusing only on one patient. So for the staff now, for the PPE, all right? I bought these P100 masks for my staff, so we each all have one, and mainly it'll be me and the assistant using this. The third one, the front office will be wearing her surgical mask at all times. Unless she needs to come back and assist, then yes, she can put her mask on. But we will be wearing these masks throughout the whole day, okay? Just to protect ourselves and to protect the patients from exposure. Also, I recommend, when you wear these, put a surgical mask over, so that we can wipe this down and just throw away the surgical mask. All right. N95 is the standard, okay? This is also NIOSH approved. However, N95s are hard to come by, so right now this is another alternative that we can use. And then face mask right here on top. We have surgical gowns that we're gonna wear, okay, for each procedure, and we change them every morning and afternoon for the time being, for now, until we can get them, so we can change them after every patient. However, if they do get soiled with blood or anything, then yes, we'll change them. We do have scrub caps, so I have surgical scrub caps to wear for me and the assistant. Face shields, so we have face shields, and then to wear. And then for the shoes, we spray them down before they leave, or I tell my staff, to bring an extra pair of shoes so they can change out of. Now with the clothes, my staff can come in with their scrubs or whatever gear they want to come in with. And then I've also recommended, hey, when you leave, to feel safe, you can go ahead and bring a spare change of clothes, so you can leave them, put them in the bag, and then take them out. So that helps with, cross-contamination and not bringing home any aerosols or potential COVID-19 virus particles back home. So it's just to keep the area safe, to keep our patients safe, the staff safe, and to keep the office clean. For disinfection, we're going to be practicing and, implementing and upholding the standard OSHA guidelines. Okay, everything will be bagged, wiped down. We're going to start wiping down chairs, before the patient comes in. Okay, and then when I had the second chair, so then the next patient can use that chair. And then the front office, she can rotate in, wipe everything down again for the next patient. So each chair will get wiped down twice. Everything will be bagged, plastic barriers everywhere. Pretty minimal. Office operatory, whatever, can be touched, we wipe down, and minimal objects around, so patients can't touch them, less cross-contamination, less things to wipe, keeping things minimal for the staff. The floors will be cleaned, okay, after every patient. So once the patient's done, we're gonna scrub them down, wipe them, mop them, let it breathe, so then it won't be a hazard, and let it dry. So we'll do that after every patient. So wipe down chairs twice, and then clean the floors. Every hour, every surface counter that is touched will be wiped down. All right, that's just to keep things up every hour. We're keeping things clean. So that's pretty much the guidelines that I have. Oh, one thing. I know there's a thing called ozone water that can be used to disinfect and to use for the patients. I do not have that device yet, but studies have shown that I've read that is very effective. So what we're doing instead of, we're just buying distilled water by the gallons, and then we just keep them stock, and then we use that for the sterilizer. We put that in the water bottle for the units, because each unit has its own individual water tank, so we know where the water's coming from, so that we're not using the plumbing, and we just make sure everything's clean, and then we can control that water and what goes in and out. Another investment that I will be planning to make is an aerosol capture. So a lot of holistic dentists do this, where they have a little vacuum and it goes right above the patient's mouth, and it just pretty much vacuums all the aerosols, and that's what we want to minimize. So that's another good investment. You can get one and roll them through the operatories, all right, and that will help with minimizing aerosols in the office. So that is a very good adjunct to practicing. So yeah, those are the few things that I'm implementing in the office. Now, the one thing that we have to realize and understand is, these are precautions. How long will these precautions last? We don't know. So, before you jump into investing an aerosol filter, the vacuum, the HEPA filters, the UV lights, or anything fancy, we kind of have to anticipate what the return of investment is, and for how long we're going to be using that before it's not necessary to operate a dental office. So just keep that in mind before you start splurging and buying things. But these are simple ways that you can do to help protect yourself, your staff, and then your patients. So, also for the lobby, I've changed a few things. So what I did was I put no chairs. All the chairs are stacked to one side on each other, and very open lobby. Get in, do your thing, get out, appointment. Minimal interaction with the patient, and building that repertoire is going to take a hit. But, if your patients have been with you for a long time, they understand. Communicate through text, if anything. And you could, the relationship will still be there. It'll just be a little bit harder. Maybe feel a little bit rushed, but, with the community that you're building, the office that you're building, they should understand, or they will understand what you're doing to help protect them and your other patients, and they'll appreciate you for that. And I think they'll stay for the long term. All in all, that's pretty much it. Those are the changes that I'm doing. Hope you guys are staying safe and practicing safe social distancing. Make sure to wear your mask at all times, wash hands, and all that. And, we're all in this together, so let's keep that in mind, when we do things. Make sure you're not the only one that's being affected. All right, so this is Dr. T, signing out. Thanks for watching.